ended up in a homeless shelter because of domestic violence. I was afraid to remain there in Georgia, so I just got on the Greyhound bus and I just came to Washington. I didn't know anybody here. I didn't know where I was going when I got here. I just got on the bus and I just came.
When you look at the lives of homeless people, those living in the street or even those living in shelters, they're very fragmented lives, very difficult. They have to go here for food, there for shelter, somewhere else for health care. And I think Unity's job is somehow or another to bring a holistic approach to improving their lives.
So I'm Nikkia's case manager. One of the things that she struggled with as she came into DC, for someone like her, where she was very vulnerable, some of the decision making was just like completely poor. Understandable, she was not compliant with treatment. Telemedicine played a very big part in that aspect.
When they decided to do telepsychiatrists here, I was asked to schedule the patients, and that is how I met Nikkia. We set her up, and she came to her first appointment. She was a little hesitant, and I explained to her how easy it was going to be.
And I just remember Nikkia being like, "Are you going to be able to help me?" And I think that I was able to assuage her concerns and her fears about her continuity of care by saying, "I'm here for you."
Telehealth helped me because when I first came here from Georgia, I didn't know, like I said, I didn't know where I was going. I didn't know anyone here. I still don't know my way around Washington, but I don't need to know my way around Washington. Everything's here.
We are where the patients are. Patients can come to us, they're able to walk. Sometimes they don't have to worry about bus fare or metro fare. They can come to us and we provide everything they need in our community centers.
I like to thank the staff here at Unity. I love them to death. I love them so much. They were so helpful to me. They got me back on the right track. They gave me hope. I was so mentally broken when I got to Washington, and to have them do that for me, it meant, the world to me. I really hold a special place in my heart for them, for that.
She embraces her mental health issues and I'm sorry. It touches me because a lot of our patients, they don't want to accept who they are. She accepted and she embraced it. And she's like a role model for a lot of us, not just the patients, but us period, to learn how to accept what's wrong with us and learn how to deal with it and work through it.
They didn't look at me differently because I was homeless. They didn't look down on me. They didn't act funny towards me. They treated me like I was a person. They treated me with respect. And I really love them for that, and I thank them for that.
I guess they call them the undeserved or the lower class. We all are human. We all need help, whether it's a hug, a handshake, a bottle of water, some food, Medicare. So I feel like it's important for us to get those funds, be able to address a lot of the issues that people can't afford.
Unity is not just a medical facility. Unity is a hope. It's a strength. It's something that you pray for and you finally get.